We are videotaping the presentation tonight. Okay, so.
Okay.
Am I on? Okay.
You're on.
So I'm Dr. Lindholm. Many of you I've met. Some of you that are Dr. Martin's patients or Dr. Hartman's patients I haven't met yet. So welcome to the workshop tonight. The whole reason we do the workshop in this fashion or in this way is that we really have the idea that knowledge is power. The more you understand about your health care and about what you can expect to receive from your care here at the clinic, the better results you get. Okay, so we call the workshop 45 Minutes to Freedom. And we're going to talk not only about chiropractic issues, but really about health care in general, because one of the things that I think is important for people to understand is really how chiropractic care is different from conventional medicine. It's a whole different health paradigm, or a whole different way of looking at health. Okay? And I want to start actually by telling you a personal story about myself. One of the reasons that I'm so passionate about chiropractic is that I started out as a chiropractic patient myself. My story is actually different from what most people think of seeing a chiropractor for, in that I was only 5 years old the first time that I saw a chiropractor. And it's kind of a long story, but when I was about 5 years old I started to develop severe stomach pains. And my parents took me to my pediatrician, who examined me and couldn't find anything wrong with me. And over the course of months, the pains unfortunately kept getting worse and worse. And my parents took me to several different doctors trying to figure out what the problem was. Finally, through the course of this, one of the men that worked with my father suggested to my parents, you ought to take your son to my chiropractor. She's been able to help me a lot. Maybe she can help him. Well, my parents thought that chiropractic was just about back pain. And they've told me that they even commented to this man, his name was Clarence, they said, why would we take him to a chiropractor? He doesn't have any back pain. And plus I was only 5, so they were kind of scared actually to take me to a chiropractor. Anyway, to make a long story short, we finally ended up at a specialist's office, a medical doctor, who again told my parents they couldn't find anything wrong with me, but they ran a whole bunch of tests, mostly just to appease my parents. At this point, the pain my parents told me was bad enough that I was literally not playing at all. I was spending most of the time just crying, or just being in bed complaining because of the stomach pain. So they took me to the hospital, they ran these tests, and as usually happens when they do that, they couldn't tell my parents anything right away. So they sent us home. And actually on the way home, they drove by this chiropractor's office, and she miraculously was able to get us in right then. We didn't have an appointment, we stopped in, or my parents stopped in, and she examined me, and she explained that I had some subluxations, as I'm going to talk about tonight, or some misalignments in the middle part of my back, in my thoracic spine. And she went ahead and adjusted me that first day. And she explained that the nerves from that area come around and help to control your stomach. She said, I can't tell you for sure this is going to cure his stomach problem, but she said it's very common if you have a subluxation. It can make those nerves hyperactive. It can actually cause the stomach to secrete too much acid, and it could be irritating his stomach. So she adjusted me. And a lot of this I don't remember because I was 5, but I remember the next day. I remember the next day waking up, and the pain was 90% better. It wasn't that it was 100% gone, but it was dramatically better. I was able to get up and play again, be a normal 5-year-old. Well, the real ironic thing is that the specialist called back the following day from the hospital with the test results. And the first thing that my parents said they did was apologize. They said, we have to apologize that we told you, there was nothing wrong with your son, because the test results definitely show that he has some ulcers in his stomach. And we want you to bring him back in, and the doctor wants to do this medication, that medication. And my parents had seen enough success from that one adjustment. They said, well, I think we're going to do something different. So they followed up with the chiropractor's recommendations, and I went in for a series of adjustments, kind of like some of you are doing, or like Clark is doing, and the problem went completely away. Because the problem in my case wasn't really in my stomach, it was in what was controlling my stomach, which I'm going to get into in a second. So the reason I tell you that story is that chiropractic is much more than just about back pain, but also I'm going to talk a little bit tonight about spreading the message of some of the things that you learn here in chiropractic. Literally, I've touched thousands of people's lives through what I do as a chiropractor. That really, if that man that worked for my father hadn't spoken up and said something to him, we probably would have never made our way to a chiropractic office. And unfortunately, I probably would still have stomach problems now because the problem wouldn't have been corrected. Okay, so we'll get onto the actual material here. When I talked about comparing chiropractic care to conventional medicine, one of the problems with conventional healthcare is how it really, how just the whole system works. The reality when we look at health is that we're all really on kind of a health spectrum. So let's say that optimal health is here, and then poor health, or I would even say that the ultimate extreme is death, is at the other end. Okay? And we're all somewhere on this health spectrum. The problem with conventional medicine is we don't even access the system usually until we have some kind of a disease, some kind of an actual problem. And usually that means we're way down on this end of the spectrum before we seek care. Unfortunately, with many serious illnesses, as I'm going to get into in a second, some of the top killers as far as disease classifications, a lot of times the symptoms don't even occur until the problem is fatal. You know, somebody can have heart disease and not realize it until all of a sudden they have a fatal heart attack. Or a woman might have breast cancer for decades before it's even detectable on a mammogram, before it's detectable. So one of the differences with chiropractic care is it's really about restoring optimal health and then trying to keep at this end of the spectrum, about being proactive or preventative. It's a very holistic approach, but it's also a very vitalistic approach that we know as chiropractors that the body has an innate ability to heal, a God-given ability to heal. And if we can just remove interference, that healing or that vitalistic ability can be expressed. So the problem is that, as I said, that conventional medicine is very reactive or symptom-based. This quote is credited to Thomas Edison. It says that the doctor of the future will prescribe no medicine, but will interest his patient in the care of the human frame and diet and the cause and prevention of disease. And it's a very good description, even though he wasn't talking about chiropractic back then. It's a very good description of what we do as chiropractors. It's a much better approach. So what we're seeing in healthcare here is overutilization of drugs in many cases. A mess in the popular press. If you asked most people, what they think the state of our healthcare system is, most people would say that it's not very good. And this has definitely been borne out in the popular press as well as in scientific literature. That medical interventions, unfortunately, are increasing. Prescription drug use is increasing. Surgical interventions are increasing. A lot of medical interventions are increasing that are inherently dangerous, but we don't see an increase in health and longevity, really, as I'm going to get into in a second. So we're really not getting at the cause of the problem. Another issue, which isn't nearly as important as the human issue, but also there's definitely a cost attached to this, that medical healthcare costs are skyrocketing. The increase just in prescription drugs is astronomical, that by 2017, the estimates are that we'll be spending enough money on prescription drugs with $516 billion, that literally that alone will bankrupt our economy, even if we didn't have any other issues going on, which unfortunately we do. So this talks about that if current trends keep going just with prescription drugs, that by the year 2020 we'd be spending $5 trillion on pharmaceuticals alone. Okay. Now this is really what I want to focus on, though, when we look at conventional medicine, is not so much the dollars and cents cost, but literally the life cost. And by the way, I should have mentioned this at the beginning of the presentation, that all of these kind of numbers are not my opinion. These all come from scientific literature. As a matter of fact, most of these numbers actually come from an article that was published in the Journal of the American Medical Association, or JAMA. It's the most well-read, well-respected medical journal in the world. So these are well-documented numbers. What they did is they looked in 1 year at the causes of death related to medical care, and many of these were for inpatient hospital settings. Okay, so they found that there were 32 deaths in 1 year due to surgery-related problems or accidents. There were 88,000 deaths due to infections in hospitals. Now this doesn't these infections they were looking at weren't somebody that went in with an infection, but somebody that went in for something else and then got what's called a nosocomial infection, or and many times these are dangerous because they tend to be the drug resistance, more virulent type of infections like staph infections. There were 98,000 deaths that were due to medical errors. A huge one, though, that you should remember the number for is that there were 106,000 deaths due to what they call non-error negative effects of drugs. And what that means is that it wasn't a malpractice thing. It wasn't that the doctor or the nurse gave the patient the wrong drug or the wrong amount of the drug, which can happen. That would be up under the medical errors classification. These were people that got supposedly the right drug for their problem, but still had some kind of a fatal reaction and died from that intervention. And then on top of that, because these top numbers were from inpatient settings, they looked at, in a separate study, they looked at the number of outpatient drug errors that caused death in that 1 year. And there were astronomically more of those, 199,000 deaths, because there's a lot more people that take medication on an outpatient basis than an inpatient basis. So that comes out to a little over 500,000 people in that 1 year that died, literally due to medical interventions. Now, I'm going to talk about this a little bit later, that sometimes medical interventions are necessary and sometimes they're appropriate. But it's just important for people to understand, when we look at the fact that there's safer approaches like chiropractic, that we need to keep in mind that literally it's a life or death issue when we look at people having access to a safer, more natural approach. And just by a show of hands, some of this, like I said, is very, was published in mainstream journals. Did any of you hear about that there were 500,000 people that died due to medical interventions?
Is this in the United States or worldwide?
This is in the United States only. Yeah.
Wow.
And so that is really a travesty because this didn't make the popular press, and there's a bunch of reasons we could talk about for why that happened. Mostly the control and the power of the pharmaceutical companies, which, by the way, they employ more lobbyists to Congress than there are congressmen in Congress, and they employ more lobbyists that are ex-congressmen than any other industry in the country. So it's a huge issue that most people aren't even aware of. But when I talk about the safety of chiropractic, I'll kind of come back to these numbers a little bit. Some other issues, when I talked about that we're spending more, we're doing more invasive things, but we're not having better health care, this just kind of backs up some of those things, that unfortunately the life expectancy and infant mortality rate has declined over the years instead of improving. As of September 2010, the United States was ranked 49th for both male and female life expectancy combined. Back in 1950, we were 5th among leading nations. Infant mortality rate, the U.S. is, we're 41 places behind other countries for infant mortality rate. So that one surprises a lot of people. A lot of people think, well, if I have a baby born here, I would think that they would have the best success at a healthy start to life, but unfortunately that's not true. So some of the issues with this are that some of our education as a country comes from people that really shouldn't be educating us about our health care. Places like food manufacturers that try to trick us into buying processed foods. The reason I have 10% healthier here is there was an ad campaign for Lucky Charms where the ad campaign was saying Lucky Charms is now 10% healthier because it has iron. And it's just, it's still a garbage food. It's still a dessert, not a healthy food. Okay, so pharmaceutical companies, which I mentioned, some of you are old enough to maybe remember this, that it used to be illegal actually for pharmaceutical companies to directly market to consumers through television, through newspapers, they only could market to medical doctors. Now their tactic, because they know it sells drugs, is to market to consumers directly. And it's hard to watch television for more than half an hour without seeing several drug ads. Sometimes all the Viagra ads, I feel like I have to put my hand over my children's eyes or cover up their ears even. But what's interesting is that we've really become numb to some of these things, that when you watch television, they spend twice as long talking about all the side effects as they do the positive effects of the drugs. But people still are taking skyrocketing levels of pharmaceuticals. So really one of my words of advice is that we need to be smarter. We need to really seek out information. I won't spend a lot more time on this, but I mentioned this before, that when we look at some of the top killers in the United States, many of these are things that are very preventable, and that many authorities call these diseases of affluence or lifestyle. In other words, they're things that have to do more with lack of healthy lifestyles, like not eating correctly, not exercising enough, not doing the things that you can change yourself. These also, unfortunately, are very costly disorders when we look at the amount that we spend on them as a country, and that. When you look at the percentage of gross domestic product and so forth, that's something, again, that is a huge deal. And things that have tripled or that have changed over time here. So what can be done is that really we need to have an integrative approach. And I don't know, have any of you heard of the term integrative medicine? Okay, integrative medicine is a term that means a combination of conventional medicine and holistic or natural interventions like chiropractic care. And it has been shown to be very, very effective, which I'll get into in a second. Traditional medicine, in my opinion, is very important for things like traumatic services, emergency services, some diagnostic services, but really isn't a great first-line approach. I tell people that a real simplistic way to look at it is conventional medicine is kind of like the firemen. When you have a house in your fire, you want the firemen to come and put out the fire. But unfortunately, firemen sometimes use axes, to chop down doors and to let the smoke out. But you wouldn't have firemen come out after the fire to rebuild. And just like you wouldn't hire a carpenter to come and fix it when it's all in a blaze, okay? So chiropractic care or alternative medicine tends to be more like the carpenters. We're trying to fix the actual underlying problem. So when there's emergencies, sometimes you need conventional medicine. But unfortunately, most of society, most of the U.S. society uses traditional medicine all the time for all their interventions. Okay. So integrative medicine, when I talked about it being effective, there was a 7-year study that included alternative medical providers, mostly chiropractors and osteopaths as the primary care providers. And what they looked at, or what they found, was that when they followed these patients, it was done actually by an insurance company where they followed these patients for 3 years, and there were thousands of patients they followed. And what they found was that in this, to be part of this study, they had to see a chiropractor or see one of the alternative providers on a regular basis. I think they had to be seen 14 times in a year as a proactive approach to health. And what they found is in this group, there were 60% less hospitalizations, there were 62% fewer outpatient surgeries, and 85% lower pharmaceutical costs. So definitely this approach, the chiropractic approach and an alternative approach, is very, very effective. And when you contrast this with that slide I put up that showed the number of deaths, imagine if you had nationwide 60% less people going to hospitals, or 60% having surgeries, or 85% less people using drugs. When you talk about 500,000 people, dying from those interventions, this literally could save hundreds of thousands of lives if we could adopt this kind of approach. And basically, it was shown to be very effective. And actually, one of the lead authors, his name is Dr. Sarnett, who's a medical doctor in this study, said that hopefully these results are so dramatic that they would wake up the medical community and cause a immediate need for true integration. Unfortunately, in healthcare, things don't tend to happen quickly, especially when you're battling, like I said, large companies like pharmaceutical companies. But definitely, it's important for people to understand this. So where does chiropractic fit into this picture? Unfortunately, most people think of chiropractors just with dealing with back pain. Really what we do is, spinal pains are really a warning signal that there's a problem in the spine, there's spinal dysfunction. And if you don't pay attention to it, it can lead to more serious problems that we want to avoid, like back surgery and so forth. Really, it's not about your back, but it's about the nerves that come through your spine. The reason that we work with the spine is because it houses or protects those delicate nerves that allow the brain and the body to communicate. So there's a strong tie between the spine and the nervous system, and activation and even development of the nervous system, especially in children as they grow and their body develops. So it's really not about pain, it's about maximizing the function of the nervous system. So again, that vitalistic approach, so that the ability of the body to heal can be expressed. And that really is a biological truth or biological law that our bodies are innately trying to reach homeostasis, or innately trying to balance. But we literally have trillions of cells in our bodies, and those cells have to communicate to be able to work together. And it's through the nervous system that all those cells communicate and function well. And that's why chiropractic care can have so many different kinds of effects, is because it not only affects things that people many times think of seeing a chiropractor for, like aches and pains and headaches and neck pain and back pain, but it also affects things like sinus problems and constipation and sleep problems and fatigue. Also a lot of pediatric kind of things that people don't always think of, like colic and ear infections and bedwetting and those kinds of things. And it's not that chiropractic is really a treatment for any of these things. These are all signs of subluxation, signs of a problem with the nervous system being able to control and coordinate the way that person's body is functioning. Okay? So that's why when you're sitting here in the waiting room, there might be a child sitting next to you that's coming in for attention problems. There might be somebody that has a little baby that's coming in that their baby has colic. Okay? And as we're talking about in a second, there might also be patients here where we have a lot of patients that come in and don't have any complaints at all. They're coming in to improve the function of the nervous system so that their body stays healthier, so that it functions well. Okay? Now, the importance of the nervous system is really hard for me to overemphasize. It's so basic that it's hard for people to comprehend that literally the nervous system controls every cell, tissue, and organ in your body. Okay? It literally is how we decide whether somebody is alive or dead. We can keep somebody alive on a ventilator if their heart's not beating, but when they stop having brain waves, when they stop having nerve activity, is really when we consider them to no longer be alive. Okay? It literally controls even how we experience life. In other words, you're hearing me speak. You're not only hearing me speak through your nervous system, but you're comparing everything I'm telling you to what you've already known in the past, and you're processing that data or that information all through your nervous system. You know, an example I use is that if I were to have you get up and I were to have you run down the block and then come back, your physiology would change. You'd start sweating, your heart rate would increase, your respiration would increase. All that is controlled through your nervous system. That's how your body adapts. Just like right now it's helping your body to digest your lunch, and your heart is beating, your lungs are working. All that is happening automatically, but it's through those nerves that it's happening. So a subluxation, or the main problem that we treat as chiropractors, is a misalignment in the spine that affects the way that nervous system functions. Sometimes it can actually be a pinching of the nerve, like this picture shows. Sometimes it can be a pulling or a stretching of the nerves. Okay? But it literally affects, like I said, the way the muscles work, the organs, how you feel, and even brain activity, because that nerve supply goes both directions. There's nerves coming from your brain out to your body, but then there's just as many nerves coming back to the brain that actually help to bring the brain to threshold, and that's why it can help with learning and with mood and so forth. Okay. So what causes subluxation? Subluxations really come from physical, chemical, and emotional stress. Most people think of physical stress, but I'm going to start off talking about emotional stress because in my experience, I've been in practice almost 20 years, this tends to be one of the biggest causes of subluxations. Because the nerves work both ways, your body responds to emotional stress by many times causing what's called a viscerosomatic reflex. That, let's say you're under emotional stress, you can tighten up the muscles and literally pull the spine out of place instead of knocking it out of alignment. And this is scientifically valid. That, I know you probably can't read this. Basically, this is a textbook diagram that shows how information comes into the body and then feeds up into the brain. And what we know through research is that a trauma or an actual injury to the body feeds into the nervous system and then goes up into the brain in the same area that emotional stress feeds into the nervous system and goes up to the brain. So the brain has trouble distinguishing between real physical damage and emotional stress. Okay? And this, like I said, is a very common cause of subluxations. Maybe not the entire cause, but at least a component of the cause of subluxation. Chemical stress is similar, that we're all exposed, unfortunately, to chemical stress, whether it's in the foods we eat or drugs we're exposed to, or even the air we breathe or water we drink, alcohol and things like that we might be exposed to. And some of that our body definitely is designed to handle. Our body has an innate ability through the liver and through the kidneys to detoxify, but it's arguable that we have more chemical stress, unfortunately, in our environment than ever before. We're eating more processed foods, we're being exposed to more chemicals, vaccinations and so forth, which can be definitely harmful or can inject toxins straight into the bloodstream. So chemical stresses definitely the same way as emotional stress affect your nervous system and then cause almost a reflexive subluxations many times in response to that stress. The physical stress is what most people think of when they think about their spine. Things like falls. They may not think about children falling, but if you watch young children, it's not uncommon for them to fall. It's kind of even hard to tell what she's doing. That's her head, and she must have been running at the beach and took a nose dive. Yeah. I have 4 children, so this is not. I've seen that firsthand. That's not uncommon. But it doesn't have to be those kinds of falls. It can be repetitive things also. Somebody sitting at a computer all day long looking down or working bent forward for long periods of time can cause the same type of trauma as a sudden impact. It just happens more slowly over time. Okay? So if somebody asks you, what causes subluxations, if you just say stress, you don't have to say it's physical, chemical, and emotional stress. You're accurate. Okay? If you want to give them a better explanation, you can explain it comes from other things. And really, the sad truth is that most people need to see a chiropractor because we're exposed to physical, chemical, and emotional stress on a regular basis. Okay. All right. So I already talked a little bit about this, but this diagram just shows an example of how the nerves go to the organs and to and from the spine. I already mentioned this already, that that information flows both directions. That there's information going from the body to the brain and from the brain to the body. It's a two-way street. They call this homeostasis, or a better term that's newer is called homeodynamics. Your body is always changing and adapting. It's part of that vitalistic biological law of your body trying to be healthy. Okay? But it's regulated through the nervous system. Now, when there's nervous system breakdown, it can sometimes lead to pain. I'll talk in a second about that. Unfortunately, only about 10% of the nerves control pain. So a lot of times pain is not present with subluxations. But it can cause other changes in sensation as far as numbness or tingling, loss of muscle strength and coordination. I have a number of athletes that I treat that come in mostly because it gives them a competitive edge, that they perform better. And world-class athletes utilize chiropractic, whether you're looking at football players or Lance Armstrong, you know, competing in the Tour de France, or if you're looking at Olympic athletes. More seriously, long-term subluxations can cause neurodegenerative problems. They can actually cause diseases of the nervous system, such as Alzheimer's or Parkinson's, or be a contributing factor to that. And as I mentioned before, it can lead to things like depression, anxiety, or even attention problems. Now, here at our clinic, we have a number of different ways that we assess you when you initially come in. Some of them are very high-tech, like some of the subluxation station scans that we do on you that actually allow us to measure how the nerves are functioning. We can look at the action potential, the electrical signal coming from the nerves. We look at posture, we look at x-rays many times. With some patients, we look at the arches in their feet, or we do an evaluation of that, because that can sometimes affect their posture and the way they stand. And all of these things are important because, like I said, many subluxations don't cause pain initially, or they may not accurately cause pain right where the problem is. So a lot of these tools we utilize because they help us to see basically hidden health problems that you might not be aware of. They also, many of them are things that we can retest for to see how you're changing or improving over time. Okay? Now, one of the things that we do that isn't the most high-tech thing we do, but I want to cover a little bit tonight, is looking at somebody's posture. And part of the reason I want to cover this is that I mentioned about telling others about chiropractic care. Your posture is kind of a window into looking at the health of the spine. So this is something that you all can do with other family members or with friends you have. You can look at their posture and have a good clue as to maybe how healthy their spine is, and encourage them to see a chiropractor. So the basics are that when you look at somebody's spine from the back, it should be straight, which means your head, your shoulders, and your hips should be in line, or should be level from the back. Okay? Somebody who has a shoulder that's dipped, a head that tilts one way, or a hip that's high, even somebody that has a knee that's tilted, and can all be signs of not only a scoliosis, maybe in a really severe case, but of subluxations or misalignments in the spine. Looking at the posture from the side, it's very different. That you're supposed to have arcs or curves. You're supposed to have a forward arc in your lower back, a backward arc where your ribs come off, and you're supposed to have another forward arc, or a lordosis it's called, in your neck. Okay? I know this shows a straight line. Really what they're looking at is that the head, the shoulders, and the hips, and the feet should all be in line from the side. Okay? So a very common problem we see is a forward head posture. And I really blame this on the fact that we do so many things where we're looking down nowadays, whether you're a student in school all day, or whether you're sitting at a computer, or maybe you're reclined back in a recliner watching television or reading. We tend to be in that posture a lot. That's a very dangerous thing as far as your nervous system, because it can stretch the nerves that come through your neck and really cause some major problems with that communication of the nerves back and forth through the neck. Okay? One of the things that you have in your packet is a little card that looks like this, and that's just for you to take home. It actually gives you some primers as to how to do what I was just describing. So especially if you have children at home, or if your spouse is at home and isn't a patient here yet, it's a little thing you can do to again evaluate or look at their spine. Okay. And when we talk about hidden subluxations, like I mentioned, only about 10% of the time do you feel it, which means 90% of the time you won't. And symptoms, unfortunately, a subluxation can occur long before symptoms develop. As a matter of fact, a lot of times symptoms are the last thing that show up. Now, once we determine that somebody has a problem, there's different phases of care that we go through here in the clinic that I should explain to you. And you should already understand some of this, but the first part of care is really designed to get you feeling better. It really is kind of like putting a Band-Aid on it, though. And what I mean by that is that we're doing as much as we can to correct the problem, but we're a lot of times initially not able to correct the problem all the way. We're starting that process. The reason I mention this is that some patients mistake this first part of care for the problem really being done. It's important, though, to continue on with corrective care, where we're trying to restore the underlying problem, the alignment, continue relieving symptoms, and then move into rehabilitative care, where we're restoring and strengthening, stabilizing. We're seeing the patient a lot of times less frequently at this point. And then our end-term goal for all of our patients is more of a wellness approach, where we're maintaining the correction that we've made and keeping them healthy. So some patients come in and they say, I just hurt really bad, doc. I just want you to adjust me a couple times until I feel better. And I always tell people that that's not what I recommend. You know, occasionally I will do that with patients, and then usually more often than not they end up coming back in months or years later because we haven't really corrected the problem. That's what I meant by the Band-Aid care. So our approach is different from some chiropractors, that we really want to correct the underlying problem. Kind of like an orthodontist shifting your teeth. We need to do it a little bit at a time. Okay? So it's important as you get partway through your care and you're feeling better, that you continue with care to really correct the underlying problem. I want to next talk about a sheet that you have in your packet that looks, I need to skip ahead here, that looks like this, okay? And if you can actually pull it out so you can take a look at it. I mentioned that many diseases that plague our society are lifestyle diseases. One of the things that chiropractors are specialists in is natural approaches to health. The most important thing we do is correct subluxations, but we also are experts in things like nutrition and exercise and stress reduction, relaxation, those kinds of things. Okay, so I think it's important for people to set health goals. We have to make changes usually with our health incrementally. We can't change everything all at once. Okay, but there's lots of times for most patients things that you could be doing yourself that cost little or no money that could really improve your health. Okay, so this is just between you and your doctor. You don't have to share this with everybody today, but I'd like you to pick at least one or two things that you'd like to set as health goals. It doesn't have to be one of these. It could be anything relating to your health. It could be that you want to exercise more, that you want to reduce your stress levels, or you want to have less pain, those kinds of things. And I would encourage you to go through the...
All five.
Was it all five of them? Just pick one or two at first. And then when we get that one taken care of, we'll tackle another one. But I would encourage you to actually fill this out and then bring it in and show it to Dr. Martins or myself, and we can help you along that process. Especially once we get further through your care, when we're into that wellness phase of care, is when a lot of times we really start to focus on some of these things. Okay, but with some people, it's important for them to even get results initially that we start focusing on some of these lifestyle things. For example, like when I was talking with you earlier today about Clark and his diet and some of those things, sometimes with certain patients, making changes can really help them to respond faster to their care or get the results that you want them to get.
When did I start?
What's that?
Anytime.
Anytime, yeah. And that is one of the things I would recommend as you do this, that you write down the goal, that you put down a target date of when you want to achieve your goal. I always tell people that a goal without a target date is really a dream. Okay, so you need to have some a date to shoot for to give you a sense of urgency when you're working on your goal. It'd be important for you to put down how you're going to reach that goal, and then also to think ahead of what obstacles might I encounter. Okay? And then put down even your action steps. So let's use as an example that your goal was you wanted to start exercising. Okay? So you could put down that, and I would say a really specific goal would be I want to be able to walk a mile, okay, as my exercise 3 days a week, and then put that I want to be able to achieve this by a month from now. Okay? So then,
You can do it.
so then maybe some unforeseen obstacles are maybe that you're going to realize, well, soon there's going to be snow on the ground, okay, or that might be raining out. So you might want to think about, how am I going to do this? What can my plan B be when I can't go outside? Do I have a treadmill? Can I go to the mall and walk? Okay. Your action steps might be things like make sure I have a good pair of tennis shoes, map out a mile route in my neighborhood that's safe. Find a partner, find somebody that will hold me accountable that I can walk with, so I have somebody to talk with to make it more fun and so forth. Those kinds of things, okay? So, and I only use exercise as an example. For another person, it could be eating healthier or reducing stress or those kinds of things, okay? Any questions about the goal setting? All right, and like I said, many of these things can be done yourself at little or no cost and can have dramatic effects on improving your health. Because the reality really is that you are responsible for your health. As I mentioned early on with some of the statistics, we really can't count on getting the best information sometimes from other entities as far as the government or your insurance company or drug companies for sure. And I think it's important for people to realize that they're in control, that they can be empowered by the fact that they can make dramatic changes in their health. And to show you how dramatic it can be, there was a study done by Dr. Ornish, and some people might have heard of him because he's actually kind of a famous doctor. He's famous for creating a diet that seemed to really help people that have heart disease, that already have heart disease. But he did a study on a group of men that had prostate cancer. And I can't remember the exact details of the study, but I think there were like 200 men in the study, and I think they studied them for like 6 months or a year. What they did in the study is that these were men that had prostate cancer that was confirmed, but for some reason or another, these men didn't want to do conventional treatment. They didn't want to do radiation. They didn't want to have prostate surgery. So Dr. Ornish set up a plan where he dramatically changed their diet. They ate all unprocessed fruits and vegetables and whole foods, or in this particular case it was organic foods. They exercised every day, and they had every day where they did a relaxation meditation kind of a technique for relaxation. And what they did is before they started the study, they not only did the prostate testing, but they actually did genetic testing of each individual to see what their genes were. And a number of them had markers genetically for cancer. And after the study, they repeated that genetic testing, and they found that just doing these lifestyle approaches turned off or genetically changed, I think it was 95% of the markers in these men had been changed or improved, which is more dramatic than you would get with somebody who did traditional approaches. So just lifestyle approaches can be very, very dramatic on a genetic level. And that's kind of another whole topic, but we used to think that our health was largely determined by our genes. There's a whole area of research now called epigenetics. And actually what happened was that there was a large-scale worldwide project called the Human Genome Project, where scientists worldwide were mapping out the human genes, and they were successful at doing that. And they thought when they did that they would have the answer to most health problems, that they would be able to predict who was going to develop Alzheimer's, who was going to develop MS, or who was going to develop diabetes, and be able to make an intervention or a change to prevent that from happening. And what they found was that unfortunately it's not nearly that simple. That we all have genetic tendencies, but how those genes are turned on or off, or how they're expressed, is really important. And there was a different study that correlates with that. There was a study called the Danish twin study, where they took identical twins that have exactly the same genes, and they found that in most cases they had vastly different health expressions. One might develop cancer and the other one doesn't. One has diabetes and the other one doesn't. And what they found was that the researchers believe that only about 70 to 80% of your health is due, or excuse me, only about 20 to 30% of your health is due to your genes. 70 to 80% of your health is due to how those genes are expressed. If you ever get a chance, just do a Google search on epigenetics. It literally means upon genetics, EPI genetics. It's a very interesting field of study. But one of the things we know is that nerve supply, what we do when we adjust patients, affects genetic expression. It affects that ability of your body to control that gene expression, as well as diet and exercise and all those things. Okay, so I encourage people to be proactive, to address potential health problems before they become serious problems, to learn how to be well, which, like I said, is a whole different mindset than conventional medicine. We need to switch our frame of reference from how do I keep from getting sick to how do I prevent illness, how do I stay well, okay? And I tell people that they should really take action. It's important if you do have an illness or a condition you need to see a conventional doctor for, that you ask them, what's really causing my disease? Are there any alternative treatments? One of the things that I think should be malpractice is when something more invasive or dangerous is done, like prescribing a drug for something that could be changed with diet, or doing back surgery on somebody that could be corrected with chiropractic care. Okay? Looking at not only what the treatment options are, but what are the risks and side effects, making sure you understand those. Always trying to use non-invasive, using invasive procedures as a last resort, and also that you should always feel like you're part of the decision-making process, that the doctor's not dictating to you exactly what to do. The sad truth is that far too many people, like I said, are dying too young because of not having access to safer approaches to health. Okay? One of our missions here at the clinic is to tell as many people about a natural approach in chiropractic as we can. Okay? So we have several different ways that we can do that. One is just by you communicating it. And this is a very simplistic diagram, but it gets the point across really well. You get well and we keep you well, and then your family comes in, we get them well, and then you have a healthy family that then helps others get well, and then their family gets well, and then before you know it, we've got a whole community that's well, okay? And unfortunately, because we don't have, and when I say we, the natural health community or chiropractic as a profession doesn't have the money like the pharmaceutical companies do to put up ads every half an hour on the television. This is really the grassroots way that it has to work. Okay, so please help us spread the message. One of the things that we do that I always tell patients about is that we're members of a group called the Foundation for Wellness Education. It's a nonprofit group where we basically do educational lectures. One of the, can I borrow this? One of the things you have in your packet is this green sheet. These are different workshops that we do here at the clinic. And these will be changing here next year. We do some of them over again and we rotate them. So we don't just talk about natural health, but we actually provide in-depth education for things like stress reduction and attention and boosting your immune system, exercise, those kinds of things, okay? But we also offer those through the Foundation for Wellness Education at area groups. So if you belong to a group like a service club, or if your church or your business, if they do wellness kinds of talks or topics, please let our office know, and one of the doctors is, if we can work in her schedule, is very willing to do those kinds of things to help, again, get the message out. Whoops, I went the wrong way here. Another great way you can do this to help spread the message is through a program we have here called Care to Share. And what that is if you have a friend or a relative that should have their spine checked or that should be in here under chiropractic care, you can, today you can sign up. There's a list here on the back counter, or really, to be honest with you, at any time you can let our staff know, and we'll give you a little certificate called a Care to Share certificate. And basically what it is our new patient exam is normally $100 and allows patients to come in for $25 for that new patient exam. And we feel like this is important for people that may not take that first step to get under chiropractic care, to maybe remove some of the financial hurdle for them so that they can get in. So that's a program they should take advantage of if you can. Okay. And there's no obligation. We don't, we don't contact the person directly. We give you the certificate and then you can hand it on to the patient. Occasionally we do have patients that say, my sister really needs to get in here. I want you to give her a call, and they give us their number. But for the most part, that's optional. Okay. Right, and then these are just the references for my presentation. So if anybody's interested in where some of the statistics or the things that I cited came from, it's small, but I'd be happy to print it off for you. I'd be happy to go over it with you. Okay. So, in closing, does anybody have any questions about anything that I covered? You were a great audience. Nobody fell asleep tonight.
Does that happen often?
Not often, but it's that time of night when people have okay? So the other thing I didn't mention is the book that you have that we gave each of you. It's called Chiropractic Works. That's just your gift to take with you. Feel free to read that. It's also something you can pass on to others. Some of the information in there actually came from one of the largest investigations into chiropractic. Oh, we need to give them a book. One of the largest investigations into chiropractic back, I believe it was in the 70s.